In this video, I have several remote healthcare jobs to share with you guys. And don't get discouraged if you don't have healthcare experience. I have several options that are entry level friendly, and some of those pay as high as $34 per hour working remotely. So you definitely want to stick around for that. And if you happen to have experience with medical billing and coding, especially, and if you're a certified coder, I have over 31 opportunities for you, and most of them pay a bonus on top of that. So they have a $1,000 to $2,500 sign-on bonus for most of the roles at this particular company. So you want to stick around for that as well if you're a medical coder. Thank you so much for joining me. Welcome back to Home Base Haven, your safe haven for real work from home jobs. And if you are new here, please be sure that you are on my email list. I send my jobs out first to my email subscribers so they can jump on those leads right away before I share it to the masses on YouTube. So you want to make sure you're on that list. Let's go ahead and jump into the first company. As you could tell, is with CVS Health, and they are one of those companies that's always hiring. I shared a role with them recently. This is a new one I'm sharing with you today. This is Claim Benefits Specialist, and this is, of course, fully remote. And in this role, it says you're going to review and adjudicate claims in accordance with claim processing guidelines. Claim benefits specialists have the opportunity to enhance and improve member satisfaction and retention by providing accurate and timely resolution in processing medical claims. And don't be discouraged again if you don't have healthcare experience or claims experience. Let's go into what they want you to have to apply for this role. The experience is in a quality or production environment, not healthcare specific, attention to detail, and the ability to use multiple computer applications at one time. I can almost guarantee for the majority of you, whatever role you've worked before, you meet these three simple requirements because they're kind of built into everything that we do these days. So if you've worked Microsoft Office, Google Suite, any kind of software program at all, that qualifies. Attention to detail is required for any role. And chances are you've had to meet some sort of productivity or quality standard, and that's what that means there. Now, to get back to what you'll be doing in this role, first of all, to not be encouraged if you're new, you have a 21-week training period for this. So they really make sure that you are set up for success in this role. If you know anything about healthcare, of course, processing claims is an extremely important part of making sure the company gets paid. So they want to make sure that their individuals in these positions are well equipped and knowledgeable. So you have a thorough training program, and in the actual role, you're going to determine and understand the coverage provided under a member's health plan, efficiently use multiple systems and screens to obtain and record claim information, review the claims information, identify the cost management opportunities, and things of that nature. Preferred qualifications, so these are just bonuses to add to your resume if they apply to you. If not, do not worry about it. Prior medical claim processing experience, of course, is a plus. Exceptional analytical skills, accurate and fast keyboarding skills, advanced computer navigation and knowledge, and experience in a Windows environment. Most of you could add at least one or two of those as preferred qualifications based on anything you've probably done before. Effective verbal and written communication skills, the ability to adapt quickly and willingly to change, and a positive, willing attitude. Successful candidates should be comfortable with quality goals, production goals, and being able to keep up with the standard. An associate's degree is also preferred as well. So again, these are all preferences. If they apply to you, add them. If they don't, do not stress it. As you can tell, like I said, they give you a 21-week training, so you'll be prepared for the role. Education minimum is a high school diploma. It's a 40-hour full-time role. And the pay ranges from $17 to, like I mentioned, $34.15 per hour for an extremely entry-level remote healthcare job that is rare to see. The roles here at CVS tend to offer that a lot in the benefits and claims departments. So that is common to see with CVS specifically, but not in a lot of other companies. So just wanted to share that with you. And like I shared, I believe it was last week, they are hiring for another benefits verification specialist. Typically with these roles, they need a lot of individuals. So this one is under the same umbrella as the other one. This one in particular, you're going to complete and document benefit verification review. So it's kind of more on the front end versus the back end like claims. Provides information on the home infusion services. You're going to comply with and adhere to all regulatory compliance areas, communicate with medical professionals and insurance company personnel, provide input on self-reviews, assists less experienced peers, and the requirements again are very entry level friendly. Minimum 1 year of experience working in customer service or a call center environment, again, not healthcare specific, data entry experience, and working knowledge in Microsoft Office, specifically Outlook, which is for email, and Microsoft Word. And then they have the preferred qualifications here, which do not stress that. And also, the pay is very similar, just a little bit less on the high end. It's $17 to $31.30 per hour. So, two great opportunities to take advantage of at CVS. Now, let's go into the next one. This is with Allara. I have shared this company before. I believe it was last week as well. They had a similar role that was titled Clinical Concierge Agent. This one is a Patient Concierge Agent, and they're actually still both listed, so they are two separate roles. And if you're not familiar, Allara is a comprehensive women's health provider that specializes in expert longitudinal care that supports women through every stage of life. And in the patient concierge agent role, you're going to be the guide for patients navigating hormonal health care. This role is a key part of the care team, providing compassionate, detail-oriented support to patients while ensuring seamless communication with providers and internal teams. You'll interact with patients via phone, email, and in-app messaging, assisting with appointment scheduling, answering questions, things of that nature. The key responsibilities, we kind of went over that. Let's look at the requirements. It's 1.5 years of experience or more in a customer support and or patient-facing role, preferably in a remote setting, but it's not required. Strong verbal and written communication skills, and going back, customer support, meaning in any area, any industry, they didn't specify healthcare. Exceptional attention to detail, ability to problem solve creatively, strong technical skills, comfortable navigating a computer, medical reception experience, and familiarity with electronic health records is of course preferred, but again, it's not required. And a quiet private workspace with reliable internet, which of course you need for any remote role, so I hope you have that. The schedule is Monday through Friday, 9 a.m. to 5 p.m., 30 to 40 hours per week. This is a contractor role, and it's $20 per hour and 100% remote within the U.S. So those of you that have been interested in not only remote roles, but a contract position, this is a great one, especially that is entry-level friendly if you want to work in healthcare in the digital space. And please go ahead and hit that like button if you like any of these roles so far. If you see anything that suits you or someone you know, please like, subscribe, make sure you hit the notification bell so you don't miss out on these roles. Let's look at the next company, which is Datavant. They are looking for a billing and collections specialist. This one is specific to anyone that's had healthcare experience. If you don't, after this, I'll go into some entry-level friendly roles that they have as well. So again, billing and collections specialist. This is remote, full-time in the U.S. And Datavant is a data platform company and the world's leader in health data exchange. Our vision in that every healthcare decision is powered by the right data at the right time in the right format. Our platform is powered by the largest, most diverse health data network in the U.S., enabling data to be secure, accessible, and usable to inform better health decisions. So in this role, you're going to be responsible for managing the day-to-day billing, reconciliation, and collections processes for Datavant's payer-focused lines of business with a primary focus on Apixio. And then let's go into what they want you to have to apply to this role. So like I said, this one requires more experience. So they prefer that you have a degree in accounting, finance, or business administration or something similar. That's not required. What is required, though, is 2 to 4 years of experience in healthcare billing, revenue cycle management, or financial operations. Familiarity with medical coding and retrieval services is preferred. Experience with accounting or billing systems like NetSuite or similar is again a preference. And strong understanding of billing, collections, and account reconciliation processes, intermediate to advanced Excel and Word skills. And they give you some examples, pivot tables, formulas, and reporting functions. You could put that into YouTube or, ChatGPT or whatever you prefer to use as a Google. And you can actually have it break down for you, these types of functions in Excel so you can learn them if you don't know already. Proficient in Microsoft Office Suite and capable of working with large data sets, highly analytical, detail-oriented, and comfortable interpreting complex billing data, effective verbal and written communication skills, and demonstrated ability to work independently and meet deadlines, and excellent organizational and problem-solving skills. And then here, there's the salary. It's $51,000 to $60,000 per year. Okay, and that again is a full-time role, with healthcare, with Datavant specifically. And let me show you two other roles that are entry level friendly with the same company. This one I shared not too long ago. This is the CPC processor customer support role. As you can tell, it is a customer based role. So think call center environment. The hours are 8 a.m. to 4:30 p.m. You have to be comfortable with a high volume production environment. You're going to be processing medical record requests by taking phone calls from patients, insurance companies, and attorneys to approve medical record status. And they didn't really list much at all in terms of the actual requirements. Yeah, they literally don't even have a requirement. So this one, entry level, is something you could jump on if you just need to start working somewhere that's entry level friendly. Maybe you're new into the workforce, or you have some experience, but maybe it's been a long time. You just kind of need something to fill in a gap, or you just want a placeholder for right now because bills don't stop and you need a placeholder, or you want to switch to remote from maybe your in-person role, something of that nature. This is a great entry level role that you could apply to. On the low end, it is pretty low, but on the high end, it's 1832. So it's something, um, like I said, as a great placeholder, but the range is 15 to 1832, of course, typically depending on your experience. So that is one entry level friendly option. The other one is a health information specialist one. This is another full time role. And this one, they tell you, again, this is a breakdown, the hours, again, 8 a.m. to 4:30, high production environment, similar position in terms of what you'll be doing. And they also didn't list requirements for this. So that tells me it's also very entry level friendly. And on this job description, though, there is no pay listed that I saw. If you see it, and I'm like looking at it right now and I'm just looking right over it, you can put that in the comments below. But yeah, I don't see an actual pay listed clearly on this job description, but it's probably similar to the last role, that $15 to $18 and change per hour. Okay, and then last but not least, for my medical coders, on Datavant's careers page, please go to this filtering system on their careers page and just select medical coding. And then since we focus on remote roles here, you want to select remote under the work settings. And they right now have 31 jobs listed that are all fully remote. And when we scroll down, there's a significant number of them that include sign-on bonuses. So they need to fill these ASAP and they're willing to pay for it. So it ranges from $1,000 to $2,500 sign-on bonuses. And as you can see as I'm scrolling, there are plenty. Again, they listed 31 as of now, the time of this video. These are the options available. Excuse me. So if you are a medical coder, if you have experience, maybe you're looking for a PRN position, or you're trying to switch roles or switch to remote. Maybe you're not working remote. You want to try a different company, whatever it may be. This is a set of options to sort through and see if anything fits your need. Maybe you want to change specialties within your coding career. They have plenty of options available. They clearly need it. So you probably are definitely have the advantage going in, applying with a certification and work experience. They're probably going to be eager to bring you on, especially if these roles here have sign-on bonuses. Okay, so I just wanted to share that with you all. And again, please make sure you check the job description, or excuse me, the description box, tongue-tied, below. I have a link there for JobScan. Remember to utilize JobScan. I spoke about it in several videos before. It's a great platform to help you build your resume and cover letter. They have a free account you can use, and it scans your resume against the jobs you're applying to and gives you a score right away and tells you this is strong enough to submit your application, or it needs a lot of work or some work, whatever level. And they will tell you exactly what to change, you guys. They'll tell you what to fix. It's based on information they've collected from ATS systems, the ones that typically weed us out before a recruiter can see it. So this is an awesome tool that you want to take advantage of. I'll link that in the description box below. Please use it to your advantage. It's a very competitive job market. I always say, please stay encouraged. Don't lose hope. Companies are hiring, but you have to understand the reality of how saturated the job market is because of massive layoffs. Okay, so for the ones that are hiring, they're going to get flooded with people from outside of their industry more than normal. So whatever edge you can give yourself to stand out, I highly encourage that, and I have one for you below. So that's about JobScan. Thank you as always for watching and for tuning in and for sharing with your friends and family members. It helps us all. And I hope you have a great rest of your day, and I'll talk to you guys again soon.